Hello, vlog. Hello, everyone out there, and good day wherever you are. Okay, this is Janet on Kosh TV. This channel is backed by the Kente Club, which is the Kente of Expert Club International. Okay, big brains behind a small channel. Anyway, I hope you haven't been waiting in some form of suspense. Yes, in my last content to you, I did mention about going in for surgery. Okay. Remember, this channel is aimed at improving the well-being of individuals, the family, and the community as a whole. Okay, the channel is backed by health experts. Right, what happened? I went through the pre-assessment for the surgery. Pre-op assessment. I saw the surgeon, I saw the nurses, and my final health person I saw was the anesthetist. Some will say that the Americans will say the anesthesiologist. Okay. Aside my shoulder and my bad back, I have been suffering headaches. Okay, headaches with blurred vision, or dizzy spells you might call it. Blurred vision sometimes is quite confusing to me myself, whether it's actually blurred vision with dizzy spells, because there are times I have to actually take a bit of a step back if I feel that way, to be able to recover and then continue with whatever I'm doing. Okay, the anesthetist isn't too happy to put me under, okay, because he says he wants a definite, at least a working diagnosis for the condition. Remember, the surgery is going to be done under general anesthesia. So, yes, I do understand where it's coming from. I don't think I haven't done my part by reporting the symptoms earlier. I have done so previously through my general practitioner, that's the GP. Okay. When I first moved to this county, I had some investigations, MRI and the scan, but they haven't really told me much about it, except a few things that could be ignored, that may be due to aging process. But it looks like it's getting a bit more, or it's actually going to hinder a smooth progress of the surgery. So they do actually, it's actually affecting my well-being as well, because I can wake up at night with very severe headaches, and it can keep me awake all night. I mean, the headaches can be so bad. Actually, when it became so severe that I had to mention it to a doctor and a couple of health professionals, I actually thought it was due to my shoulder, because the shoulder got aggravated through work. So I actually thought it was due to the inflammation process of the bone, the musculoskeletal structure there, that was giving me the headaches. I've even seen the is it chiropractor, you would say? Yeah, I saw the chiropractor He also did his investigations and said there is a possibility that my subclavian nerve may have been affected. All right, but I'm not spreading anything yet. I'm waiting for the expert, though I've mentioned it on this platform. Situations have made it in such a way that I have to be talking about things like this in the open. So I'm hoping on the experts to do their investigations and actually come out with a working diagnosis, if not a diagnosis. So for that matter, the surgery didn't come on. I'm continuing with the pain reliefs and pain relieving measures that I can actually lay my hands on or think of. A letter has been sent to the general practitioner, my local surgery, which I will be chasing up on. So actually ascertain what the plan of action is going to be. So, in a nutshell, the surgery didn't come on because of this. So, after the general practitioner does what they are supposed to be doing and do a proper documentation, then they can proceed with the surgery. You see, it's surprising. Being a health professional and then going through this, that can be disheartening. Because you do know what the process should have been, but for some reason, I would not necessarily say it was due to my move from one place to the other. Someone just kind of forgot to do their work. Okay, someone just kind of forgot to do their work. It happens, we are humans. I mean, sometimes we forget to pick up from where we left off. But the thing is this, when it happens and someone else stumble up such a thing, you need to flag it up. You need to highlight it, because otherwise it just hinders the progress of a patient's treatment. And here I am, a health professional, going through this. The fact that I'm no longer under the NHS, that doesn't mean that I should, or if someone isn't longer working with the NHS, that doesn't mean that the person should be ignored. The person should actually be fighting so hard to actually get the treatment they deserve. I think it's totally unfair, and that is unacceptable. Anyway, I wouldn't say so much about this. I just thought I should give you an update, since I said I was going to give you a gist of what has happened from the hospital. Unfortunately, the surgery didn't come on, so we'll wait till I see a general practitioner, and then we take it from there. Right? Thank you so much for listening. And remember, this is the Kosh TV on YouTube. We aim to improve the well-being of the individual, the family, and the community as a whole. And remember that you and your community are responsible for your well-being. So make sure to be a positive impact or influence wherever you are. My next video will be something that we talk about, or we should be doing as nurses or health professionals, and you wouldn't have to wait long for that. So I come your way again, I say keep healthy and bye-bye.